topic is Ticagrelor, the new age antiplatelet. Antiplatelet therapy is essential for preventing and treating major cardiovascular diseases caused by thrombosis. As we all know, aspirin was the first drug to be started. It was launched in 1980, and then was initial. I mean, by 1997, clopidogrel came into play, and clopidogrel was very effective. But once we started doing a lot of interventions, then we happened to see a lot of stent-related complications. When you start researching about it, then we found there used to be clopidogrel resistance. That's when the need for newer other antiplatelets came into play, and ticagrelor is one of the drugs which is doing very good now. That The traditional dual antiplatelet therapy with aspirin and clopidogrel has been cornerstone of treatment of ACS and PCA. However, a significant number of thrombotic agents still occur despite benefits, promoting development of newer and more potent antiplatelet agents. These limitations have been addressed by Ticagrelor, as I said earlier. Ticagrelor is first introduced to oral reversible P280 inhibitor. Earlier, Cangrelor used to be intravenous. P280 being a oral drug, it is very easy to use, and it is helpful to continue for the patients also. It also prevents coronary and stent thrombosis and reduces risk of myocardial infarction and stroke in patients with acute ACS. It was approved in the year 2011 in the US. And the daily dosage of aspirin should be less than 100 to prevent bleeding complications. It is rapidly absorbed by oral route. Bioavailability is almost 36%, and it has a high plasma binding, and half-life is 6.7 to 9.1 hours, and excretion through feces or renal excretion. Time to peak is 2 hours. But generally, what we do in cath lab is we used to crush two tablets as 180 milligram for early peaking. The clinical trials, this meta-analysis trials showed that P2Y12 inhibitor monotherapy with the ticagrelor followed by PCA, driven by recent changes in antiplatelet therapy strategies, highlights the findings and explore their clinical implications. The major risk of bleeding was lesser when you use with lesser dose of aspirin. The risk of major adverse events were reduced by 0 up to 0.86%, and the secondary outcomes like all-cause mortality and net adverse clinical events were reduced. Alpha study assessed if ticagrelor is superior to clopidogrel in reducing pre-procedural myocardial necrosis during high-risk elective PCI, and assessed if aspirin and ticagrelor benefits patients with diabetes, stable CAD, and previous PCA. So ticagrelor added aspirin significantly reduced cardiovascular death, myocardial infarction or stroke in patients with diabetes and prior PCA. Long-term use of ticagrelor in patients with the prior myocardial infarction, it showed ticagrelor was significantly reduced to CV death, MI or stroke, but increased major bleeding. The Pegasus TIMI 54 trial assessed two ticagrelor doses, 90 milligram daily, twice daily, which was previously used, and 60 milligram twice daily, chosen to offer slightly reduced yet a consistent platelet inhibition. Both ticagrelor doses significantly lowered the risk of primary composite outcomes, cardiovascular death and myocardial infarction or stroke compared to placebo. And we feel confident in using 60 milligram twice a day in patients with high bleeding risk. And as per guideline recommendations, ACC, AHA, and the SKY recommend ticagrelor is a recommended loading dose of 180 milligram orally and maybe chewed to achieve faster action. And NICE clinical guidelines recommended ticagrelor in combination with low dose aspirin up to 12 months as a treatment option in adults with acute coronary syndrome. And the European Institute of Cardiology guidelines, ticagrelor, irrespective of the preceding P2Y12 regimen, 180 milligram dose should be initiated and continued with the 90 milligram twice a day. In non-ST elevation MI cases, undergo invasive treatment, ticagrelor 180 milligram loading dose and the 90 milligram twice daily should be started as soon as diagnosis is made. If unable, clopidogrel 60 milligram in an alternative dose. Even once the patient is loaded with the clopidogrel, the very next dose can be skipped and loaded with the ticagrelor and can be continued. The key points: Ticagrelor is a first-in-class oral reversible P2Y12 inhibitor antagonist that inhibits ADP-mediated platelet activation, reducing platelet aggregation, thrombosis formation, and risk of coronary and stent thrombosis. It is approved for secondary prevention in adults with a prior MI more than 1 year ago and high thrombotic risk as well as in acute coronary syndromes. And in patients with unstable angina, non-isolation MI, and STEMI treated medically or with the PCA or even coronary artery bypass grafting surgery. It significantly reduces cardiovascular death, MI, or stroke, especially for high-risk populations like those with diabetes and prior PCA. Associated with an increased risk of major bleeding when compared to placebo or standard therapy, especially when used with a higher dose of aspirin. Thank you.